postpartum hemorrhaging, or essentially excessive vaginal bleeding after having a baby, happens to 1 to 5 in 100 women. And one of the primary causes of postpartum hemorrhaging is, so after the baby is delivered, the uterus continues to contract. So you continue to have contractions after you've actually had the baby. And these contractions help the placenta release from the uterine wall and be birthed, or release from the uterine lining. And so when this happens, then the uterus continues to contract, because after the placenta detaches from the uterus, it leaves blood vessels open. And so these blood vessels will continue to bleed until the uterus continues to contract down and starts to close off these blood vessels, which causes the bleeding to slowly subside. And, you know, it's common to have quite a bit of blood loss after having a baby. After a vaginal birth, women can expect to lose about half a quart, and after a C-section, women can expect to lose about 1 quart. So it can be a little alarming seeing all of the blood, but your care provider can help you determine like how much is too much blood. So if the placenta does not detach soon enough, or if it only partially detaches, then the uterus might not be able to properly contract and close off those blood vessels, which could lead to postpartum hemorrhage. And you know, sometimes this starts happening right away after childbirth, but sometimes it can take a day or two to show up, or even like a week or so. So if you experience excessively heavy bleeding from the vagina that does not slow or stop, that can be a sign of postpartum hemorrhaging. And especially, you know, if you notice that your blood loss has been decreasing, but then all of a sudden it starts to increase, you know, while bleeding the first few days after childbirth, you know, there's quite a lot of blood that you lose, but it should be gradually decreasing. You know, so you shouldn't start to be noticing more and more blood. The exception is like if you've been sitting in bed for a while and then you suddenly stand up, or if you kind of go on a long walk or something and then you have a little bit more bleeding after that, that can be normal. But if you start to have like an excessively heavier flow, that could be a sign of hemorrhaging. If you have a sudden drop in blood pressure, you know, signs of shock. And, you know, signs of low blood pressure that can include kind of like a blurry vision, having chills, clammy skin, a really, really fast heartbeat, feeling confused, dizzy, feeling like you're going to faint, feeling nauseous or actually throwing up, getting really pale skin, or having a lot of swelling and pain around the vagina or perineum. This can all be signs of postpartum hemorrhage. So you definitely always want to let your care provider know if you are at all concerned about your bleeding or any other postpartum symptoms that you are having. So what will they do if the care providers think that you are hemorrhaging? So if you've just had the baby, or even if you haven't just had the baby, they will likely give you fluids. They might administer Pitocin, as this can help to cause the uterus to start to contract and expel the placenta. This is why at a lot of hospitals, they highly recommend that women get a shot of Pitocin right after the baby is born, just to make sure that the uterus continues to contract and fully expels the placenta. In, you know, more extreme situations, a woman might need to have a blood transfusion. The doctor might need to do surgery. In serious situations, they do a hysterectomy, which is the removal of the uterus, but that's pretty rare. They can also do what's called a laparotomy, and this is essentially going into the uterus and trying to find the source of the bleeding and stopping the bleeding. They might also just massage your uterus by hand, because sometimes that can stimulate those contractions and help that placenta come out. It can also help you pass any blood clots. They will want to remove any remaining pieces of placenta. And this is often, can be done by the doctor going into the uterus manually with their hand and like scraping the placenta off of the uterine wall. Yes, that's uncomfortable, but it can really work. And then, they'll likely have you take extra iron supplements just to, again, improve those iron levels. So I know it sounds scary, but it is certainly not something that happens every time. Your care providers are going to be carefully watching your blood flow after having a baby. They're going to carefully examine your placenta to ensure all the pieces came out. So they're really going to take good care of you in this regard. But of course, if you're ever worried, if you ever have symptoms that confuse you, let your care provider know. If you have any questions about this or anything else about pregnancy, childbirth, early motherhood, let me know in the comments.